Codistar-DX syrup is a cough syrup used for the treatment of dry cough. Also for the temporary relief of cough due to throat infection, sneezing, and running nose. So it's basically used for a non-productive cough where no mucus or sputum is produced. This is a 100 ml bottle which consists of the following, as you can see, the composition. Each 5 ml contains dextromethorphan hydrobromide IP 10 mg and chlorpheniramine maleate IP 4 mg. Chlorpheniramine is an anti-allergic drug, whereas dextromethorphan is a cough suppressant. Common side effects of this medicine are drowsiness, sleepiness, upset stomach, dizziness, etc. Since it causes drowsiness and sometimes blurring of vision, you should avoid driving after taking this medicine. So it is best, if it is possible, to take it at night. How to use the syrup? You should take it as advised by a doctor. Also, you should shake well before use. It is better if you always take it at a regular time.